Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, May 17, 2022. Thank you so much for joining us. As always, it's your opportunity to ask your questions about COVID-19, but also about other things that the Chicago Department of Public Health does and cares about. And I'm really pleased today to have two guests with me. Those of you who are on with us over the last couple of weeks know that it is Mental Health Awareness Month in Chicago, and we get a lot of questions from you about everything related to mental health. And so I'm really pleased to welcome Jessica Newsom from Alternatives, Inc. and Alicia Martinez from Enlace Chicago. We'll hear from you guys in just a second to tell a little bit about what the organizations do. But in the meantime, if you're hearing things that you have questions about or you've got COVID questions, you can use the hashtag AskDrArwady on either Facebook or Twitter, or put your questions into the box below. So just to start us off a little bit, Alicia, maybe why don't you start a little bit? Tell us about who you are. Tell us about Enlace, and just so folks, get a sense of your work and can ask questions.
Hi everyone, my name is Alicia Martinez. I am the Violence Prevention Manager at Enlace Chicago. Enlace Chicago is a community-based organization that works with Little Village residents in order to improve the quality of life. We have 4 focus areas that we strategically plan in supporting our residents. So we have education, violence prevention, health, and organizing and immigration.
All right, good. So many more questions to come for you. And Jessica Newsom, tell us a little bit about your role at Alternatives, Inc.
Yeah, I'm the Director of Behavioral Health at Alternatives, Inc. We've been around for about 50 years, and we provide behavioral health services and restorative justice programming in Chicago public schools. So we have been serving Chicago's youth for a long time, working primarily out of the CPS system.
All right, wonderful. And both of these these women are here from organizations that are part of what we call our trauma-informed centers of care network at the health department. And so under Mayor Lightfoot, we've really expanded publicly funded outpatient mental health services. And some of that has been about, putting additional resources into more traditional mental health providers. And some of it has been bringing some more mental health supports into less traditional areas, right? Yes. Yeah. So some of you remember we were talking, for example, with the Lakeview Pantry folks who also have brought some mental health in to their programming, and it's been a good opportunity. So anyway, let's do a COVID update, and then we will come back, and because I really want to talk about sort of mental health, violence prevention in Chicago, how this fits together, and I know you'll have questions about that as well as COVID. So as always, chi.gov/COVID- is where you go. Every day, Monday through Friday, we update this data, and you can see what's happening with COVID in Chicago. So we're currently averaging almost 1,200 diagnosed COVID cases every day right now in Chicago. That doesn't include, of course, people who are just doing the at-home testing. It is up 27% from a week ago, and you see just the continued sort of gradual rise that we've been seeing. Hospitalizations actually look quite good. We're averaging just 18 hospitalizations from COVID a day. You can see, certainly compared to previous times when we were at high case numbers like this, we're still thankfully seeing very few severe illness or hospitalizations. Most of that's due to vaccines and boosters. Deaths also are at the lowest point still that they've been throughout all of COVID. So whereas early, at the beginning of COVID, we were averaging 50, 60 Chicagoans dying from COVID a day, we're now at a point where it's 1 or 2 in a whole week. So that's been really good improvement. You can see our positivity is up to 6.2% and continuing to rise. Now, of course, that's affected by changes in testing patterns, but definitely I would say COVID is still on the increase here, and it's important that everybody's paying some extra attention, putting those masks on in indoor spaces, thinking about spacing, testing at the first sign of symptoms. And if you do get COVID and you're at high risk for severe outcomes, make sure you're getting access to those early treatments that can help keep you out of the hospital. So I'm going to go ahead and show you, just because people were writing in and asking, how do I know what COVID risk level Chicago is at? So right at the top here, you can see we are at medium, but also always up at the top here, if you go to latest data, this is where you can find a lot of data. A lot of this is getting updated. Like our hospital capacity here gets updated every single day. So if you want to see what's happening with people getting hospitalized in Chicago, if you want to see how well vaccines are performing, if you want to see what's happening with booster coverage, you can go to vaccine coverage by dose and see broken down in different ways across Chicago what that's looking like. So I encourage you to really explore this if you're interested. And this is the exact same data we use to make decisions. But the top one here is the community transmission and risk. And I just want to highlight here that these get updated weekly. We do update for the city of Chicago. We'll be updating this later today. But the Cook County, which includes the whole region, actually gets updated once a week. So I just wanted to show you where to find that. And then let me go ahead and just pull in here, show some slides that answer some of the questions that have been come in. We'll talk a little bit about mental health and then get to your questions. Okay, so first of all, at the medium level, masks are strongly recommended indoors. And if Cook County does move to a high level, which I definitely think could happen, potentially even in the next few weeks, if that were to happen, we would only do a mask requirement if our hospital numbers here in Chicago were getting threatened. So there's been some metrics that have been set. Basically, if we were to see 10 hospitalizations per 100,000 per week, or more than 10% of our beds being taken up with COVID patients, that would be a sign that our hospital system was getting stretched. That would really be the setting where we would consider doing a mask mandate. But in the meantime, as cases continue to go up and as regionally hospitalizations are going up, when the CDC reports out on Cook County risk, they actually look at the whole what's called health service area. So it's Cook County, Lake County, DuPage County, and McHenry County, all included within that. So we're keeping an eye on this, still at medium now, but heading closer to high. And if you look at the country overall, I won't go into detail here, it's online, but you can see that Northeast Illinois is mostly yellow, medium, just like us, and we're starting to see those dots of orange, which marks high, and unfortunately that is the direction that we're heading. But while our hospital numbers remain as good as they are, we'd have to see twice as many Chicagoans getting hospitalized to need to be thinking about mandates. Nevertheless, it is a point of concern. Reminder, as a travel advisory, if you're traveling to a county that's at medium risk, we recommend wearing the mask, and if it's high risk, just wear that mask, put it on, and we recommend against traveling to high risk counties if you're unvaccinated, and if you do, staying home and quarantining. Here is what our variant data is. This is also available if you look where I showed you on the website. But what you see here is that everything is still Omicron. Everything, each of these vertical lines goes from February through just this week, and every shade of both purple and red there is all Omicron. It's just different sub-variants of Omicron. So you can see Delta's at 0%. We have not seen anything new arise, which is good news. It's just that Omicron itself continues to evolve. And so you see that purple, which is what drove our original surge. We're seeing almost none of that anymore. We saw that replaced by Omicron BA2, and then now we're seeing this BA2.12.1, which is at about half. You don't need to know 1.12.1. Those details don't matter. But the point is, Omicron is still very much here because of the way the variant continues to change. And a number of you have been asking, when do we think this increase will be over? It all depends on variants. I do think we need to get to a point where this latest increase, which is more contagious, is the dominant one. So that's probably going to take another couple of weeks if I had to take a guess. And then the question is, can we have a break here in terms of new variants and new subvariants? But the great news is that vaccines are working wonderfully in terms of keeping folks out of the hospital. And please get up to date with your boosters. This shows sort of across the whole country. Where you're seeing the red, that's that BA2.12. So you see how up in the Northeast there, where you saw the most orange, the highest level, that's because most of what they're seeing is that BA2.12. And so I do think, that's the direction we're heading. But as long as we're not seeing severe outcomes, it's all right. And so this is what those details are, CDC sets these metrics. And so just right now, if you look in the city of Chicago, we want to be back under 200 cases per 100,000 in the last 7 days. Right now, we're over 300. So that's why I'm guessing most of you know somebody who's had COVID quite recently or even has it now. There's a lot of COVID around, and you can see that in Cook County overall, it's even higher at 338 right now. But then the two metrics that we look at to the right are both about hospitalizations. And so the first one is about how many people are getting newly admitted with COVID per 100,000 population. And this is where we want to be under 10. And you can see Chicago's doing pretty well still at 4.9, still half of where we need to be for concern. But Cook County, which again, the way CDC considers it, it's the whole health service area, so all the way out to McHenry, that is all the way up to 8. And that is where I do think it's possible that we could, in this next week or two, potentially see us move into high there. The proportion of hospital beds that are being taken up by COVID is good, right? Less than 4% in Chicago, less than 3% across all of Cook. So this is what we're looking at when we make decisions. And so just to, if you want to go back and look at this, we'll post it. But the CDC does update its map every Thursday evening typically, and then Fridays are when we update that publicly. And we see one case metric for Cook County in that CDC data, and then the hospitalization data, like I said, are the burden on the whole federally defined health service area. We continue to track every day COVID-19 hospital burden on the dashboard where I showed you. We will adjust our community level if either the city or Cook County reached a community level threshold as determined by CDC. So if this Friday or next Friday or the Friday after, the CDC says we're moving into high, we're moving into red, we would be at high at that point. That means we would be very strongly recommending that everybody be putting on the mask indoors. We would be advising that people who are at higher risk, who are older, who are unvaccinated, who have underlying conditions should think about avoiding non-essential indoor gatherings. That doesn't mean you can't go to work or school, but thinking about being careful, moving outside, all of those things. And then major mitigation changes, and especially, for example, a citywide indoor mask mandate, which we've been getting a lot of questions about. Even if we moved into high, the city of Chicago would reinstate that or consider reinstating that if we started to see our hospital burden be threatened and hit those thresholds. And again, we'll update that level on Fridays. So I know that's a lot, but it's the main thing we're getting questions about. This is what our cases look like. You can see just continued gradual increase, but nothing like we saw with the huge Omicron surge in December. Hospitalizations, look at this. They look good. They're near historic lows. Deaths are at historic lows, so that's really looking good. These are all of our standard guidelines. Please get tested right away if you're having symptoms. And related to when should you be getting booster doses, that's another thing we're getting questions about. So right now, anyone over 12 should have a booster, basically if you got your first vaccine before 2022. So if you got vaccinated in 2020 or 2021 and you're 12 or over, you should already have had a first booster. And specifically, it's 5 months after you've completed your series. Now, yes, just this morning, the FDA authorized boosters for 5 to 11-year-olds. But I want to be really clear that before those will be available, the CDC also weighs in. So something called the Advisory Committee on Immunization Practices advises the CDC. They will be looking at this data. They are meeting on Thursday. And if they give it the green light, then yes, boosters would also be available really right away here in Chicago for kids 5 to 11. Second boosters are for people who are at higher risk. So we want folks who are severely or moderately immunocompromised, over 50, et cetera, be thinking about getting that second booster. But if you look at the data, and this is right off the dashboard, even that first booster, we're not seeing folks do the uptake like I'd like to see it. So 76% of Chicagoans 12 and up have completed their primary COVID vaccine series. That's pretty good. But only 41% have also had that recommended vaccine booster. And it makes a difference. We saw people be significantly more likely to be hospitalized and die The biggest risk was if you were unvaccinated, but then there was significant difference between being vaccinated versus being boosted. So we are strongly encouraging, as our risk is higher right now, to get up to date with those boosters. And you can explore further online if you want to look at the details by age or by race, ethnicity, what the booster uptake has been. And just a last reminder that if you catch COVID-19, nothing has changed. Regardless of your vaccination status, you need to stay home for 5 days. And then if your symptoms are resolving or gone by day 5, you can leave your house, but you have to continue to mask for days 6 through 10. And then another new update just this morning was that there's a third round of free at-home COVID tests available from the federal government. And those of you who have been following along with me, I know most of you probably ordered your first 2 rounds. You'll be happy to hear that the third round has 8 tests in it, not just 4. So I went on last night and did this, covettest.gov. It is free. They don't ask you anything except your address. So please, I'd love everybody in Chicago to order these, have them at home, and use them. And if you have COVID questions, always 312-746-4835 or chai.gov/COVIDvax. We'll get you hooked up with vaccines. We'll bring vaccine to your house free of charge. We'll answer your questions about testing or treatment or anything that you have. So that was sort of a long COVID update, but there's a lot going on. Let's switch to mental health so that our guests have a chance to get into the conversation. So we've talked. We are launching this campaign called Unspoken here in Chicago, which is about trying to turn mental health into something that we talk about, like we talk about physical health. You'll see more about this, but mentalhealth.chicago.gov is sort of the resource page where you can find information. And again, it is Mental Health Awareness month this month. I won't go into the details here. I'll refer you to a couple of weeks ago when we went into details. But under Mayor Lightfoot, the 4 main things we're trying to do is expand outpatient mental health services that are publicly funded and available to anybody, regardless of insurance status, income status, immigration status, ability to pay. We're also doing more victim services work for people impacted by violence. We're doing a lot of crisis response. This is embedding 911 embedding mental health professionals into the 911 system, and then a lot of systems coordination. And again, I won't go into detail because we did this a couple weeks ago, but the 2 folks who are here with me today are both part of the Trauma-Informed Centers of Care expansion. And this is something that sort of over 2020 and 2021, we did award 32 different organizations. The whole list is here, and you can go online if you want to see the details, to expand mental health services that are trauma-informed and integrative, based in neighborhoods, and specifically in 35 community areas of high need. Again, open to everybody. And we've also reinvested in the 5 CDPH mental health clinics. Sometimes people still ask me, oh, the city doesn't run mental health clinics anymore. We do. We operate 5 of them, and we've been growing and expanding services there. We've renovated. We've got a new Lawndale location. We've really increased psychiatric providers and services. We've reestablished children and adolescent services because that's such a need. We've increased our hours of service into the evening, and of course, much more with telehealth. So with all of that, I'm going to go ahead now, and I'll turn it first to Jessica Newsom from Alternatives, Inc. And if you can just give folks a little bit more background about Alternatives, and we'll go from there.
Yeah, thank you so much. Alternatives works in a number of Chicago public schools, over 100 Chicago public schools last year, and we focus on providing behavioral health therapy and restorative justice services. We have targeted a number of neighborhoods that are in the TIC grantee target areas, and we've seen a significant expansion, particularly in our South Side serving services. We also have a majority people of color staff, as well as therapists. So kids are getting culturally responsive care around their mental health in the schools in which they are enrolled. We also have our mission is to inspire young people to create a just future through practices that heal individuals, restore communities, and transform systems. So we think not only about the young person, the student in the classroom, but also what is the classroom needs, and how do we provide services to make that classroom more trauma-informed as well. So that's been one of our really exciting expansions under the TIC grant. We also have a resource and care specialist, and that is a new position under the TIC grant, which has connected us to a number of the federally qualified health centers in the city. The federally qualified health centers provide primary care and behavioral health care, but the behavioral health care is often limited, and sometimes the therapists are more used to working with adults rather than young people. So we've started a referral system where we are sending kids and their families to the federally qualified health centers for their primary health care needs and working with their behavioral health consultants to provide long-term intensive behavioral health therapy that's targeted for their age. So that's been a really exciting part of our work over the last year.
Awesome. Oh, I love that. There's lots to potentially talk about, and I'm sure people will have questions. And I'll hand it to Alicia Martinez from Enlace Chicago.
So as I mentioned in my introduction, my name is Alicia and I work for Enlace Chicago. We are a community-based organization that is dedicated to making a difference in the lives of Little Village residents through our 4 key focus areas. And I work under the Violence Prevention Department, which houses our mental health team.
All right, great. And it's interesting because, you know, more historically, you were more in education and organizing, is that right? You know, and have sort of done more in that space.
And as you mentioned, over the years, I've been with Enlace for 5 years, and over these 5 years, we've been able to expand our behavioral health team to not just include school-based counselors, but street-based counselors who work with young people who are sometimes not easy to access in schools because they're truants or they're already so disengaged with school that they need a much more informal setting. So that's what our street-based counselors do.
So you've got school-based and street-based.
Yes.
Oh, I like that.
Yes.
Very cool.
And so we're master-level social workers who provide comprehensive mental health support in a non-traditional way. So we provide the mentorship and the one-on-one counseling, but a big portion of what we also do is we're trying to support the schools in creating justice-informed systems versus a punitive. So that's something that we're definitely trying to do.
Okay, great.
So with the CDPH funding that we received, it's been super helpful because we were able to expand our school-based counseling team. So now we have 1 counselor serving one of our schools. So we have 4 schools, 1 counselor per school. And this has really helped us embed ourselves into the school culture. Every school has their unique needs, and us having 1 counselor in each school has helped us really support the behavioral health teams and build relationships with administration, teachers, in that hope of creating those restorative justice hubs. If our youth are seeing school as a safe space, they're less likely to come into school already in this vigilant state because just realistically in Little Village, most of our youth have experienced violence, so they're always in that vigilant state. So if we're able to create schools that are safe spaces that do practice restorative practices, then it will hopefully create spaces that see less violence.
All right, I love that. So while I get over here and sort of turn to some questions, you know, it's interesting because both of you, you know, one of the things that when we really took a systemic look at where the gaps were in mental health in Chicago, we especially saw youth, that we did not have enough services that were youth specific. And both of you talked a little bit about how it can be different to think about reaching youth. And I think, you know, certainly at the CDPH clinics, you know, we've hired, you know, folks with pediatric, psychiatric experience, et cetera. But can you talk just a little bit about, you know, as you think about being part of a trauma-informed network and particularly that work with youth, what are some of the lessons or what are some of the things that you think are especially important there? And as we're thinking about how to continue to grow this, because we know there's still a lot of unmet need, you know, what suggestions might you have?
I think it's been like the shift of looking at, particularly for us that we do violence prevention, shifting violence as kind of this bad thing, and you know, really understanding it as a public health need, and really providing trauma-informed services, looking at our youth as like they need something is happening to them, that they need this additional support, that it needs to be in a way that they feel safe in support, in getting the support they need for their mental health, has been really impactful. And being able to work with other trauma-informed mental health centers like CBOs and the the initials, the
Community mental health centers.
Community health centers. It has been really helpful.
Okay, all right.
Yeah, I think being part of such a big network has been one of the most exciting parts of this expansion for us at Alternatives. We've been able to really hone in on our specialties and refer out to partners who have other specialties as well. And I think that's been one of the things that has been really cool to see. We've also gotten connections with Chicago Public Schools that we haven't typically worked with. So there was a hosting of a number of events, just networking events with different schools that CDPH had hosted that was just really helpful for us to get to know the landscape and how things have changed over the last 2 years. We've also seen a big shift for us clinically in terms of our modality and the frameworks that we're working with. So really thinking about young people and their experiences with violence, with grief and loss, and how that shows up in the body. So rather than thinking about mental health as just something that you're thinking or just something that comes from your brain, really understanding how it impacts the body and being able to address those symptoms as well. And that's been a really huge shift for us as clinicians. That's been really cool.
Yeah, I'll tell you, we have a number of youth advisory groups and really, amazing young people that, whether we're rolling out a campaign or sort of thinking about how to talk to youth, they often are part of that. And it's been really interesting to me how much more open I feel like younger people are about talking about their mental health. And as we think about sort of having this be something that we talk about that doesn't have the stigma that, mental health, physical health, I'm very interested in the way they are helping to move that conversation. Not everywhere, there's still a long way to go, but also that we think about health not just as seeking medical care, right? And we've talked about this, that, mental health, it's not just the absence of severe mental illness. Like, everybody has the opportunity to improve their mental health, just like everybody has the opportunity to improve their physical health. And, one of the things I like about, what both of you are saying is that you're sort of doing this in less traditional settings, right? It's not always the bricks and mortar mental health clinic, although those are important where there are unmet needs. So, it's sort of a moment, I think, for Chicago where we're investing in big new ways. There's a lot of unmet need, and we're trying to figure this out. All right, so we're getting a few different questions in, some mental health related things, a good number of COVID ones, so we'll have time to do some of this. So here's a question. How does the work that you are doing relate to the social workers that CPS may have in school?
For us, they're our partners. So we are part of the behavioral health team, and we work together to address whatever is happening in the school. We've had a lot of students coming in trying to readjust to being back in the classroom. So it's like, okay, we're going to work together to hold peace circles in the classrooms. We're doing a lot of social emotional learning together. So they're our partners there. We're working together in a team to support the social emotional well-being of our students.
Okay. All right.
Very similarly, we partner with the behavioral health teams. The social workers and counselors in Chicago Public Schools tend to be more focused on supporting students with special needs. So if that's IEPs, 504 plans, whatever that looks like, some of those youth do have clinical mental health needs, and some of them don't. And then other youth that don't have 504 plans, that don't have IEPs, do have more intense or acute clinical mental health needs. And so it really is a partnership, as Alicia was saying, thinking about who is best positioned with the right resources to serve that particular student and their needs. And so we're able to work together collaboratively, thinking about, again, not only just that one student, but also the whole school, the classroom, and their needs.
All right, perfect. We'll take one more mental health one, and then we'll do some COVID ones and go back and forth. So there's a question here. Stigma is a big problem in mental health. My own family doesn't like to talk about it. How do you suggest we talk about destigmatizing mental health? How does your organization do that? Maybe you can talk about that, especially if there are folks who have trouble accessing care.
I think for us, part of providing trauma-informed services is also for us to incorporate that in our organization. So even that shift within our organization to talk about mental health support and seeking that additional support. A lot of our staff are community members, so we encourage them to seek that support. Sometimes they'll come to us and say like, hey, I'm, like, can you advise me, how do I approach this? So we kind of just talk to them about it. In our families, when we have family groups, when we're meeting with the youth, we just really talk about just the need, as just like how we take care of our physical body, we need to take care of our mental health, and acknowledging that things have happened to us that have an impact. So being able to seek that support is really important.
Mm-hmm.
Yeah, I think a lot of it goes back to environment. So when you think about a school and you think about a classroom, having a social emotional learning workshop normalizes talking about mental health before it's become an acute clinical issue, or if it is an acute clinical issue, feeling like there is a whole range of different levels of support. So if that's a group, a clinical group, where you can talk with your peers who are all facing the same issues, or if that is individual therapy, or if that is continuing to attend workshops or circles, whatever that looks like for that particular classroom, being sure that everyone's level of need is met, and thinking through how we create that environment where people feel safe to talk about that. I think another piece of it really is thinking about culturally competent care and seeing somebody who looks like you in the classroom. So again, our therapy team is majority people of color, working in schools with majority Black and brown young people, talking about mental health and their own families, their own experiences, and what that looks like.
All right. We'll take some COVID questions, and then we'll come back and get some more of these. So keep putting them in. I know there's a lot of questions. All right. Let's start with some mask ones, because there's a number about that. So Amazing Prizini on Twitter says, given the rise in cases, is the city considering a mask mandate for places like gyms? So the way that we are thinking about this, which is why I went through it in some detail, is that if the city were to put a mask requirement in place, it would be because we are threatening our healthcare system here in Chicago. So if we hit some of those thresholds of starting to really see a lot of hospital beds taken up by COVID patients, that is the setting in which we would consider an indoor mask mandate. At this point, we're not talking about doing something in gyms that is different than in grocery stores, that is different than in workplaces, et cetera. I think, frankly, if we get to that point, it's a risk across the whole city. And so if we put an indoor mask requirement in, it would go in place across the whole city, and it would be temporary, just until we were able to get back down to that medium risk where the masks would go back to be strongly recommended. So it's a theoretical, but that is how we're thinking about it. Okay, let's do one more masks one, and then maybe a couple vaccines and some more mental health. So Jonathan on Facebook says, I thought masks weren't required anymore. Why is my student at school being asked to wear one? All right, so let's just review quickly maybe what's happening with masks and schools. So the biggest thing that drives COVID in schools is COVID in the community. So when the community, we're seeing more COVID in the community, we will also see more COVID in schools. And that's what we're seeing right now across all of our schools, K through 12, early childhood, public, private, parochial, you name it. Here is what actually happens related to masks. So first of all, we're at medium risk as a city, meaning there is a universal recommendation to be wearing masks indoors, right? But also, when we have a case in a K through 12 school, we recommend that basically there is notification to, say it's in a classroom, that classroom gets a notification without the details that there's been a COVID case, and we strongly recommend that for the next 10 days, people in that classroom wear masks, but it is a recommendation. Where we start talking about requirements in schools is if there's an actual outbreak and sort of ongoing transmission, and there's high risk. So an outbreak is defined by the state of Illinois in K through 12 schools as 3 or more cases that are all within the appropriate time frame in a classroom, for example, in this particular cohort. And so once we are seeing an outbreak, meaning multiple 3 or more cases in a time frame, that is the setting in which, we're working with the school, the health department it's an outbreak and you need to put a mask on. And that's where we're saying to the school, not that classroom would need, and again, not forever, but sort of through that time period, just because we know that the risk is high. There also are other times where your child may need to wear a mask. Nothing has changed around quarantine and isolation. So if, for example, your child has COVID and they need to stay home for 5 days, days 6 or 10, if they're feeling well, they can be back in school, but they must wear a mask at that time. And then the last point would be, when might you require masking at the whole school level? So if the entire city of Chicago requires it, that's one thing. But otherwise, if there's ever a time where we're just seeing a very big outbreak in a school, more than 10% of the school population having COVID, outbreaks in almost every classroom, et cetera. That's when we would be working with the school and really recommending, saying, to the school, you should require masking. Again, not forever, for like this 10-day period to get over that outbreak. So right now, it is true that masks are not required in schools, but if there is COVID, and particularly if there's an outbreak of COVID, those are the settings in which you will see your school requiring it, and especially if it's more than just a classroom type size, that's when CDPH is working with schools. So I hope that helps clarify that. All right, View from the North Coast on Twitter. Can we talk about the mental health issues caused by carjackings and robberies? That is all that matters. So maybe let's broaden that a little bit and just think about how sort of, lots of violence in the Chicago at baseline, more during COVID, maybe some of that interconnection, which both of you mentioned a little bit, between sort of experiencing violence directly, experiencing violence indirectly as a community. Can you take the person's question?
I think there's also the factor of how COVID impacted the mental health of young people.
Yeah.
Being isolated in homes for days on end. Our young people were already facing so much trauma from living in these communities, and then COVID just really heightened those same symptoms. So I think that's what we're seeing a lot right now with what's happening is consequence also because of COVID.
Mm-hmm. Mm-hmm.
Yeah, I would agree with that. I think that there is a lot to be done to prepare for summer and to be thinking about warmer weather, people being outside, what that means for us as a city. We're excited to participate in so many of the resource convenings and summits to prepare and really connect with each other around how do we build a prevention system so that we're thinking about young people engaged in summer youth employment through One Summer Chicago, young people engaged in that and mental health therapy, young people engaged in that and getting reconnected with school. We've seen a lot of young people disengage from their educational opportunities. We want to really work with the city and the other resources that are in the network to reconnect young people to the resources that they have so that they're able to really put their minds and their energy towards the things that are preventing those situations from occurring.
Yeah, and I'll just chime in that too. I think, it is striking the school disconnection piece, right? Like that's an early flag when a child is disconnected from school, and being able to ideally sort of intervene at that point, right? As a whole system, not just as your organizations or that school, but to sort of say what's going on here, and in a preventive kind of way. And I am, obviously everybody is worried about violence in Chicago. Like it's in the news, but it's not just the news. It's a big deal, and it is up all over the country. To your point, like substance use, overdoses, violence, car crashes. A lot of this, these sort of indirect effects we're very much seeing. But I am glad, there are real investments. To your point, in a way I have never seen before, in not just the response to violence, the law enforcement side, but what are we actually doing to do violence prevention work, to do sort of what I sometimes think is pre-intervention, before a crime. And like even the One Summer Chicago, I forget who mentioned that. That's the program that employs thousands of young people every summer. this year, for the first time, they said, we're going to actually have a certain number of folks in this program have to have had some risk factor, either been disengaged from school or certain, exposure to the justice system, or, you name it, so that you're not just having programming, you're making sure that programming is meeting the kids who perhaps most need it. So, view from the North Coast, I agree with you. When we think about behavioral health, we think about mental health, substance use, and sort of violence prevention all together. It's, from the health department standpoint, making sure we're working on things like community-based mental health resources is really critical to this. Okay. Let me take a couple more vaccine ones. So I see Caleb Van Holten on Facebook. What is the point of a vaccine if we have to get a booster every 5 months? Low confidence, a good question. Low confidence in a vaccine that has to be administered multiple times a year. Is natural immunity for those already exposed no longer a thing? Okay, so, and I see BJ Borash Kish on Facebook also, do we need a booster every 6 months? So let's talk about this. The vaccines that we are using right now for COVID, whether it's Pfizer, Moderna, or J&J, all were developed against the original strain of COVID-19, like from the very beginning. And thankfully, those vaccines have continued to show amazing protection for severe outcomes. Like, if not for them, the kinds of numbers that we are seeing right now, we would be overwhelmed from a hospital standpoint. But what we've seen is that as the virus has continued to mutate, as these new variants have come, it has been easier and easier to have for them to break through the infection part. So this gets complicated quickly, but there's different parts of your immune system. There's the part of your immune system that if you see a germ that you have seen before, or that you have had some protection, you've had the vaccine, there's the part that sort of tries to stop it from even infecting you, versus the part that tries to stop it from having it go throughout your whole system and make you really sick. And the part that comes in second and helps protect your lungs, helps protect the rest of your body, that part is still doing great with the current vaccine. But what we have now is that we are seeing people get COVID still, more of these what we call breakthrough infections. But importantly, quote, natural immunity also is not lasting. And so we know that when somebody has had COVID, it's as much about how recently they've had it in some ways, because we are still seeing pretty good protection if somebody had one version of Omicron. But we are starting to see, as Omicron has continued to evolve, we're starting to see some more people who had original Omicron even in December, even getting some of these new subvariants of Omicron. Still, it's not usual. So in most cases, if people are vaccinated and boosted, is the most important thing to stay out of the hospital. But if you have had COVID in the last few months, your protection is pretty good, but we're starting to see even some more there. So the difference is that the reason there have been these boosters, and to be clear, for most folks, it was really just this one booster last year, is that helps bring the level of your antibodies back up high. So that is protective against the infection as much as it is against the severe illness. This second round of booster was a decision that was made because we know people at highest risk for severe outcomes are the ones we also, of course, most want to avoid getting infected. And so the second booster, the one that's recommended for people who are older and have underlying conditions, you'll note it wasn't made for everybody because it gives you some more protection, but not as much more as the first or the second or even that first booster did. And so I don't think this is going to be something where we're frequently doing boosters every few months. I think realistically, this is a guess, but my guess where we're heading, given that there's no sign yet that COVID has stopped mutating or that we can wish that it's over, we've got to keep it from turning into hospitalizations and deaths, which we're actually pretty good at already between vaccines and treatments. But I do think it's likely that in the fall, we probably will see an updated version of a booster that actually has been changed to be more protective against the ways in which COVID has mutated since then. The tests are going on right now. The studies are going on right now. Obviously, we know the safety is very good on this, but we want to make sure it's effective. And so my guess is come sometime this fall, there probably will be a vaccine recommendation that's sort of for everybody, but with an updated version. And that's kind of how we do flu, to be frank. Every single year, we make a new version of the flu vaccine based on the strains of flu that have been circulating in that year. And I don't know for sure that's where we'll go in a long-term way, but at least in this year, that's what I'm thinking. So I know it can feel like those boosters make it seem like that the vaccine is not working well, but next time I'm back, I'm going to show you the graphs here in Chicago, and they are, if you go on our dashboard and you go to vaccine effectiveness, you will see the differences. The peak of Omicron, people who were unvaccinated, 30 times more likely to die of COVID here in Chicago than people who were vaccinated and boosted. And even in these last couple of months when things have been pretty calm, folks who are unvaccinated, 2 to 3 times as likely to get hospitalized or die as folks who have been vaccinated and boosted. And it remains the most important protector. And that is regardless of whether people have had COVID before. That is regardless of what medication they've taken. That is regardless of everything. So I hear you. But what I can say is that Omicron is a 3-dose strain of COVID. So if you have not had that first booster, I would strongly recommend you get it, just because I don't want you to get sick. I don't want you to end up in the hospital. And if you're older, getting that second booster certainly can help as our risk is higher this summer. But I don't think this is going to be an ongoing thing. I think there will be probably an updated vaccine, assuming we continue to see COVID evolve in the way that it has. So I hope that helps. Okay. And maybe I'll take one more vaccine one real quick, because there's a lot of those. DD Ruiz on Facebook. Is it true they authorize booster shots for kids 5 to 11? So, like I said, the FDA this morning did authorize booster shots for kids 5 to 11, but the CDC still has to sign off on it. Always, there's advisory groups that look at this, and it is a combination of the FDA is saying, is this safe? Is this appropriate for this group? And then the CDC are the ones who actually make the formal recommendations for who should get immunized and when, and, you know, for other vaccines, should insurance companies cover it, et cetera. And so on Thursday, the ACIP, the advisory committee, is meeting. I anticipate they will probably give it the green light, but we got to wait for that to happen. And once the CDC and the FDA both have said we're good to go, at that point, you will be able to get a booster shot. Pfizer only at this point for 5 to 11-year-olds. Okay. I'm just trying to debate which ones to take kind of on the mental health standpoint here. So let's kind of tie it to COVID a little bit more, I think. What have you learned from COVID to help inform the work you do moving forward? I think we all do things differently as a result of COVID, but especially, I mean, you're hearing COVID's not over. And even though we're able to do most of what we previously did, I do think it's changed most organizations and most people. So do you have thoughts about, you know, how the pandemic's sort of affected that work, or what you've learned?
Yeah, I think the importance of being able to offer telehealth is huge. I mean, even if you just think before COVID, the idea that it was safe to travel on public transportation for some of our youth who are closer to the violence that's happening in the communities. Right. That is something that hasn't always been true, and certainly even before COVID. And so I think that there is a huge need to continue to offer telehealth. Now, we have been able to offer services in person now, in the last year especially, and we'll continue to do that. Mm-hmm. But being able to offer that flexibility and options is huge.
Yep.
I think for us, it made us really be creative on how we engaged our youth. Mm-hmm. Our youth didn't do really well with the telehealth. They live in households that are like multi-generational. They share spaces with siblings. It was just very hard to engage them in a continuous practice of telehealth. So for us, it was really getting creative on how we were engaging with them, finding spaces that we could still provide safe programming, but also decrease their chances of getting COVID. So for us, it's just getting really creative on how we engage our youth, finding those alternative spaces, going to our neighborhood parks. And, you know, for us, it also provided, like, sometimes our parks are seen as like, oh, they're not safe, but we're like, no, this is we're taking ownership of our spaces, our public spaces. This is a safe space for you. We're here, we're building community, we're seeing others participate in these activities. So for us, it just really helped us shift how we were doing our work.
Yeah, and I think both of these are such good examples, because like when I think about sort of it's this sort of use of technology. I mean, imagine COVID without the internet, right? Like what would that have been? It's hard to even imagine it. But I do think, you know, and telehealth also, there was some more relaxation around, you know, being able to get reimbursed for people who do have insurance, and, you know, what some of that can look like. And, you know, we had started building some of this before, but I think people were really hesitant about it. But it doesn't work for everybody. And so it's about, you know, what options do you have? And I think when, you know, what we want to build in Chicago, when we think about this trauma-informed centers of care network, and we want to meet people wherever they are, right? We don't want to wait for people to come to us. We want to say sort of what works for your setting, and it is kind of different for different people. This idea of activating spaces is something I'm quite interested in, because we know that so much about like physical location and how people, you know, do they feel like they have control over their environments? Do they feel like their environments are good for their mental health? You know, that's something that you can work on that doesn't always feel as straightforward. And this is, you know, I've been excited through the Community Safety Coordination Center at the city, you know, focusing on, let's get these vacant lots cleaned up, let's get trees planted, like things that are good for physical health, but also sort of good for mental health. But to this point of like, feeling like spaces are ours and are safe. I'm just interested in this. I mean, both of you work with young people. How do we make that a reality, or how do we support making that a reality?
I think for us, it was really crucial to partner with other organizations in the community to start to really beautify these spaces. We have, for example, a community garden that it was just kind of a space. It wasn't being used, and we partnered with other organizations. They're like, yes, let's start to make this our space. We invited the youth, we invited the community. We would do different events, bring out food, things that like, yes, that was inviting, that was building community. Because I think for us, it's been really important to go back to our roots of community care. So for us, that was a big piece of it, just partnering with other organizations and inviting our young people to be part of that process.
You have any other thoughts on that?
Yeah, I think a lot about our restorative justice work and how those principles really inform the way in which we take accountability for ourselves and each other. Whatever space that you're in, if it's in a park, if it's in a school, if it's in a community building, being able to say, these are the agreements that we are going to hold ourselves and each other accountable to in this space, and really taking ownership and leadership in the spaces that we have. And when you think about things from a restorative justice lens, you think about the way in which every person's voice is centered and everyone gets to have a voice in deciding how we treat each other and how we treat ourselves in a space. And I think sometimes there's this conception of restorative justice that it's like soft and not thinking about accountability. But I don't know any truer accountability than, this is my space, this is also your space, how can we live together in it in a way that is safe? And I think that that's a huge part of how we start to come together. We talked a little bit about carjacking earlier, just thinking about the ways in which we want to treat each other. And knowing that it's up to us to hold ourselves and each other accountable for those concepts. And being part of building those agreements means that you are more accountable to them and what that looks like. So I think that's a huge part of how we take spaces and bring that accountability to them.
Yeah. Again, interesting. Two different perspectives there. So we're coming up on time a little bit. How can people learn more about Enlace and alternatives? Is there anything else I want to thank you first for coming on and sort of being part of this conversation. I think so much for me as we are not done with COVID, as is obvious, but we do have the technology, to this, I'm just thinking analogies here a little bit, between the vaccines and the treatments now that can turn this, for the most part, into something that is not disrupting lives in the way that it was. And we're trying to sort of build on the lessons of community voice and spaces. And, there's been some good things that have come from COVID also. But it's like, how do we make sure those lessons turn into things that we bring into the spaces for all the other things that affect our city? And, I think especially that behavioral health space, of course, has been such a major space. So anything you feel like you didn't have a chance to say, and let folks know how to learn a little more about Enlace and alternatives.
Yeah, well, you can learn more on our website, which is alternativesyouth.org. We have an info sheet as well as a way to request an intake for therapy. And then I think the only thing that I would add besides that is really just thinking about, again, that ownership piece. How do we take leadership stances in whatever space that we're in to hold ourselves and each other accountable for treating each other well? And I think that's the best way, as Alicia was saying, to think about community care. And mental health is as you said, not just found in the individual, but it's found in the communities and in the schools and in all of the other spaces that we have together. Okay, great.
Yeah, so for us, it's our website is enlacechicago.org, ENLAC, chicago.org. We have a lot of, again, we are very community centered, so even within our violence prevention department, we have a violence prevention collaborative that works with different organizations in the community. And so if you're from Little Village and you want to support young people's mental health and be a role model for them, we invite you to that space.
Okay, wonderful. Thank you again, Jessica Newsom from Alternatives Inc. and Alicia Martinez from Enlace, two of the really strong partners in this trauma-informed centers of care network that we are building across the city, and we're actually expanding it further this month because it's been really good to have different partners where people have different needs. You can refer among them. You could get connected, and many are very, very strongly tied to particular communities, which has been good. So I want to thank you for helping us, talk some more about Mental Health Awareness Month. We will be back next Tuesday, May 24th. We will be updating our website and everything on Friday, and we'll put out, an update and a release, particularly if there is any movement between levels. Please rest assured that our hospital numbers, once again, are still, thankfully, quite good in Chicago. You getting boosted, getting everybody vaccinated and boosted, and if somebody does get COVID, making sure they get connected to those early treatments helps us keep those hospital numbers down. I do not want to have to put a mask requirement back in for the city of Chicago unless we have to. We would do it if we were threatening our hospitals and if we hit those benchmarks. So we'll be keeping a close eye, but there is a lot of COVID, so please do be careful, but enjoy the warm weather. As it is warm, getting outside is one of the easiest things you can do to decrease your risk of COVID. And so we'll be back next Tuesday. Actually, the Tuesday after that, which is the one after Memorial Day, we are not planning to be on at this point. I'm actually going back to Michigan and giving my high school graduation talk, which I think is going to be fun. But next Tuesday we'll be here, and then if we are seeing more questions and concerns related to COVID and we need to add additional sessions, we will. So thanks again. Have a good week, and we will see you next Tuesday. And happy Mental Health Awareness Month.